or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, friends. Tonight we have a very, very special guest. He's been on before. One fantastic young man, Dr. Shah. Dr. Shah is with Arthritis and Rheumatology Associates. Am I correct, Doctor? You're on now?
Yes, I can hear you. Yes, Arthritis Rheumatology Center of South Florida.
Doc, lower your volume just a little bit, please.
Sure.
Is that better? Good. Dr. Shah, you've been on with David DePino a couple of times, and, you know, we had you as a great guest, and you're a tremendous guest. Your office is located, am I guess, right next to Northwest Regional?
Right next to Northwest Medical Center, yes, sir.
Northwest Medical Center, correct?
Yep, 5901 Colonial Drive, Suite 303.
And that phone number is 954-281-8891.
Yes.
Now, Doc, are you taking all kinds of insurance? You take Medicare and the rest of, and many other insurances too?
Yes, we're actually one of the only offices that almost take 95% of the insurances that are currently out there on the market. We take Medicare, we take all the commercial insurances like Humana, United, Preferred Care, Cigna, Aetna, Blue Cross. We also take some of the Medicaid plans for some of those less fortunate. So we also do take some of those plans, some of the Ambetter plans. Again, on our office, we take roughly 95% of the insurances that are currently out there on the market. Our office does take them.
Doc, you have a very interesting background. Your background, especially in internal medicine as well as rheumatology. Tell us a little about where you went to school and how long you've been practicing.
So I went to school at St. George's University down in the Caribbean. After that, I went and did my residency at Long Island College Hospital up in Brooklyn, New York. I still love Brooklyn. I still think it's the best food in the entire world. After that, I did my fellowship at SUNY Downstate Medical Center. So I was there in New York for roughly about 8 years. After that, I decided to come back home. This is where I was born. I was born in South Florida in Palm Beach County. And so I decided to come back home and start working down here. I've been a board certified rheumatologist for the past 5 years, and we've been in this current location for the past 3 years.
So you specialize also in internal medicine, correct?
Yes, sir.
So you really can treat the whole body as a general practitioner and a family physician? As well as
so yes, I can. So while I am double certified in both internal medicine and in rheumatology, I usually try to guide my patients only on rheumatology. I can always give them some advice about some of their other primary care needs and their family medicine needs, but I usually try to let their own primary care doctors manage those acute issues like high blood pressure and diabetes and cholesterol. And I really want to concentrate on their arthritic complaints, on their bone structure, and really try to get to the bottom of possible autoimmune diseases.
You know, as you grow older, like me and a lot of us, we suffer from arthritis. Now, I said this a couple of times, I have a couple of problems with my knees. I've had two torn meniscus, and apparently arthritis has set in. And like, an older person, I sort of don't want to go for surgery if I don't have to. So
of course,
you basically try to avoid surgery as much as you can in your practice. Am I correct?
So, yes, 100%. So our goal is basically to try to get you symptom-free as much as we can. Again, we've had patients with horrible knees, and they look really bad on imaging, that they don't look good on x-rays or on MRIs, but the patients are doing fine, and patients are saying, listen, I'm still able to do my daily activities. We usually don't tell patients to go get their knee replaced unless it's really impacting their daily activity. We really emphasize on trying to fix the rest of their body. So if your knee is really hurting, try to do a lot more quad exercises, kind of get your lower extremities a little bit more stronger with physical therapy. There's also treatments for symptoms with pain, whether it's Tylenol or NSAIDs such as ibuprofen or Aleve. At times, some of those patients do need intra-articular cortisone shots, which we do in the office under an ultrasound. So a lot of our patients love seeing that needle actually go right exactly where it's supposed to go into that knee joint to get them that quick relief. Outside of that, we do recommend, again, we do sell a bunch of natural vitamin supplements, but we also recommend possible visco supplementation. What visco supplementation is, it's basically like hyaluronic acid you're injecting back into the knee joint. So it's building back that cartilage, because when you have a lot of arthritis in the knee, it's basically rubbing together, and that's what you hear when you're walking. You're hearing that rubbing together, and it kind of is like two rocks rubbing against each other in that knee. And so we really recommend sometimes doing those cartilage injections to kind of put some space in between those two bones, so it stops rubbing against each other. And usually that kind of can prolong their need for surgery.
What would a patient anticipate if he didn't know he had arthritis? What would some of the symptoms be for arthritis? Or where would arthritis occur? Could it occur anywhere in the body?
So we get patients that have arthritis everywhere. So obviously we also have patients that get arthritic complaints and have autoimmune diseases that affect their ears. We also get, again, patients that all the way down to their first toe, such as gout itself. So again, arthritis can occur anywhere in your body. The word arthritis obviously is like any type of inflammation of a joint, but we again see all types of autoimmune diseases ranging from lupus to relapsing polychondritis to rheumatoid arthritis. So we see a big gamut of autoimmune diseases. But again, arthritis in its own self can happen anywhere. We get a lot of tennis elbow, golfer's elbow. We do see a lot of patients with trigger fingers, and they're getting their fingers stuck and just can't open them as much. A lot of patients with a lot of tendonitis or bursitis in their shoulder as well. So again, yes, the question about can it happen everywhere? It can happen everywhere in your body. And so our real goal is to focus on why it happened, what the cause was, and how we can prevent it from getting worse and treat the acute symptoms.
Doc, what is, people say arthritis. What is arthritis? What is it? I mean,
so
I hear
arthritis,
cancer, I hear area disease, but what is arthritis?
Yeah, so arthritis in its simplest form is basically just like having an inflammation of a joint. That's basically what it is. It doesn't tell us that it could be what type of arthritis it is. Again, arthritis is just a very generic term. It's like saying you're going to the grocery store. It's not really saying which grocery store you're going to. It's a very generic term. But any type of joint pain and joint inflammation is basically technically classified as arthritis.
And what are some of the causes of arthritis? I mean, how do you get it? What causes arthritis? I don't know if that's a good question to ask or not.
I mean, that's a fine question. So again, we really want to separate what type of arthritis they have. So again, if it's related to an autoimmune disease such as psoriatic arthritis or rheumatoid arthritis, again, that's an autoimmune condition. So that's their body attacking itself and causing that type of inflammation and joint disease. And we do know some contributing factors. Smoking definitely can worsen that. Obviously, having a family genetic predisposition can also impact that patient. We're still learning a lot more about these autoimmune diseases, on what else can cause it. Other than that, there also is a lot of the most popular arthritis in the world is something called osteoarthritis. And again, that's what we usually see here in the office as well. It does happen in the older population, but it's not only strictly for the older population. It's a lot of what we call a wear and tear arthritis. So if you get those people, those athletes that have been around, and they start to develop early signs of arthritis because it's just really going on and abusing their joints and their bones. So they end up forming arthritis as well. So again, and that type of osteoarthritis is really impacted by what their diet is as well. Again, we're really trying to advise people to decrease their fried food, their fatty intake, really eating a natural, healthier lifestyle there, really decreasing red meat and a lot of alcohol. Smoking, again, it contributes to that, as well as, again, obesity. Obesity, again, I know everyone hears about it and everyone talks about it, how it can worsen your diabetes and your blood pressure. But obesity does play a huge role in arthritis, especially for the back, the knees, and the hips. So again, that's a very common cause. We got a lot of patients that have arthritis in their hands, and they complain about all the arthritis in their thumbs. But a lot of it is about how we can try to tell the patients on how they're holding their cell phones, how we can alleviate some of the things. Have you seen nowadays, everybody's on their cell phone. Everybody's holding the cell phone kind of the same way. And so it puts a lot of strain on that base of their thumb. So really trying to mitigate some of those symptoms that they have by sometimes just changing up their daily routine.
So some of the questions people say to me, well, I got arthritis in my knee, I got arthritis in my shoulder, my back, And the question is, are you saying now, can this arthritis sort of go away with the proper diet, the proper exercise, weight reduction? Is that all causing some of the arthritis?
It definitely is a cause. And again, I cannot say for sure if it's going to go away completely, but it definitely will start to decrease its symptoms. So those patients that have a lot of arthritis in the shoulders, we send them for physical therapy. We might end up needing to give them a cortisone shot. They'll decrease their symptoms so they're having less pain. But we also show them how they can further their daily lifestyle and not cause worsening pain of that shoulder. And again, with the right diet, with the right exercise, losing the weight, it does, again, help. And it's not just the medications. Again, as a rheumatologist, we do a lot of medications with a lot of, again, autoimmune disease, a lot of immunosuppressive medications, but not every patient needs those medications. We really want to try to get to the core of why they got that arthritis, what the cause of it is, how much damage is there, and then develop an individualized treatment plan for each patient.
Doc, we're going to be right back. We're going to take a 30-second break to tell a little bit about All County Healthcare, the sponsoring the show. We got to give the sponsors a little plug while we're talking to you, okay? We'll be right back.
Thank you.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do. Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need. And he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, folks. We got Dr. Shah. Dr. Shah is with the Arthritis and Rheumatology Center of South Florida, and I believe that's located at 5901 Colonial Drive, Suite 303 in Margay, Florida. The phone number again is 954-281-8891. Doc, if they want to call you, is it difficult to get an appointment with you?
So I hope not. Obviously, my goal has always been to be as accessible as possible. Not only can they call the phone system, they can go directly to our website and send us a message. We're open regular hours from 9 to 5. We even extended our hours on Wednesday. We're open until 7 p.m. at night. So even those patients like yourself that is working that full time from 9 to 5 and doesn't want to take off work, we actually allow have those extra 2 hours at the end of the day towards the early evening for those patients as well. We're also open on Saturdays from 9 to 12. So again, we really give all our patients an opportunity to get seen by myself and really trying to get as much access for those patients that they need.
He's a true working man's doctor. Can you imagine a doctor working 9 to 7? So he's saying if you get off of work at 5, you can still get in to see him by 7 o'clock. That means you don't have to lose a day's play of work. Am I correct, Doc? That's the reason why you do that.
Yes, sir. That's the reason why we do it. And again, a lot of our patients have really respected it, have really honored that. And we really try to give it to those patients really that, listen, doc, I really can't come in from 9 to 5. I can't get off work. And I completely understand it. Even if I was sick, I'd be really hard pressed to get to the doctor if I was knowing that I have to get to work. So it's really, I think, a really helpful thing that we offer in our office. Again, those Saturdays, I think everybody loves those Saturdays, especially with less traffic, less school traffic on the road. So, and we're there from 9 to 12. And so we're really able to give as many patients the opportunity to get seen by us.
So that means Dr. Shah has his wife, Monica, has got to be a very, very understanding wife because he's out there working to heal all you patients. And she's home with how many children, Doc?
So I have 2 kids. I have 2 daughters. I have a 5-year-old and a 3-year-old. We just celebrated my 3-year-old's birthday. We just really just came back from Disney World. It's the first time we've been really out for the past year and a half since obviously the pandemic started. So obviously with all of us being vaccinated, we figured, okay, let's give it a try. I can tell you this is probably the last time I'll be in Disney World in the next 2 years.
So now everybody in your family's sort of been vaccinated except the kids, right?
Yes, yes. So we have my parents, most of our neighbors, our entire office. So again, I'm really adamant about trying to make sure our patients and anybody that we're in contact with is getting vaccination. Obviously, the data has been looking great for patients that are vaccinated. I myself have been vaccinated since December. And so we're really adamant for all our patients, especially on our treatments, whether they're on immunosuppressive treatments, they should still be vaccinated. And there has been a good amount of data that patients that are on our autoimmune disease treatments, they do not get worse than patients that compared to the general population.
Well, you know, that's another thing. And a lot of patients are concerned about going to an office. I'm sure you have a lot of social distance in your office. You don't have a lot of patients waiting at one time. Am I correct?
Yes. So we've done. Yeah. So we've basically done everything we can to limit that contact when they come into the office. We don't allow patients to bring in their family members anymore. So they're coming in the office. We have a really short waiting time, and they come straight back into the examination room. Everything is cleaned before the next patient comes in that room. Everybody's wearing masks no matter what, and it is mandatory for them to have the mask on, especially when they're talking to me or any of the clinical staff. We make sure we have hand sanitizers throughout the office. So we've really done as much as we can to really minimize that risk with COVID-19. But again, we also offer telemedicine appointments. So those patients that are unable to get to the office or still fearful of really trying to mingle with other patients or the clinical staff, we offer them opportunities to do telemedicine, whether it's via your phone. We even offer it via FaceTime. We even offer it via a desktop app. So there's a lot of different avenues for them to be able to access telemedicine.
Well, that's great, Doc. You see what I'm wearing around my neck? I'm going to give myself a little bit of plug. This is, I know
Sure.
Peter talked to you about this. This is our Link Plus. This is something that every senior should have. If you have rheumatology or arthritis or whatever problem you may have, this is a system that all county now is providing to their patients. This is a complete telemedicine product where you can make a phone call on it. You can see the patient. You can talk to the patient. It's both audio and visual. I'm going to make sure Peter gives you some information about this because this is something you might want to look at because this is reimbursable by Medicare for if you're going into any remote patient monitoring or chronic care management. This is a great product for you to have with your patients because Medicare will reimburse you for it. This is
Perfect.
Link Plus. It's a brand new system. We just developed it. Took us over 4 years to develop it and over $4 million. So it's something you've got to look at. It's a tremendous thing. And I'll have Peter talk
Of
to you
course,
about
we'll
it. I
do
might even come in and talk to you about it myself because I think that's how
Of course.
important it is.
Come on in.
Now,
Yeah,
one
I
of
mean,
the-
you're not too far from us.
Yeah, one of the other things, Doc, is you got quite a history. Now, I understand you were Rheumatologist of the Year. Am I correct?
Yes, yes. It was awarded from the Arthritis Foundation. It was a great honor. It was a great award ceremony. I was really privileged to accept that award.
Now, listeners, how many people do you have on a show that are rheumatologists that you're talking to right now on this show that you could say he was Rheumatologist of the Year? That's like being, let's say in baseball, that's like being the Hall of Famer for the year. All right, he's like in the Rheumatology Hall of Fame. Okay, so this is somebody you really want to see. He's young enough. He's got the experience. And I'm looking at him right now, and you can see him on our Facebook. And he's got quite a background. Tell us some of the other things. You did also a walk for rheumatology too, for arthritis.
Yeah, so I'm very involved in the Arthritis Foundation. To me, it's not about just about seeing patients in your office and in working. I really want to try to give back to the community, and that's again why I moved back to South Florida. I really want to not just be the doctor in the office. I want to be able to contribute to patients that can't get to see me, but also the outreach and everything that we're doing now is really just trying to help patients or anybody else understand arthritis. They understand what they should do, when they should see somebody, at least just give them some basic background knowledge about it. So part of that, again, is I'm involved with...
And you'll spend some time with some of these seniors, your patients, talking to them and tell them exactly what the problem is, right? It's not in and out.
Exactly. Yeah.
I mean, you're a real family physician where you talk to the patient.
Exactly, yeah. So again, and that's why we do a lot of community outreach programs. We go to a lot of nursing homes. We go to a lot of assisted living facilities. And basically, I'm going there just as basically some education. I'm not going there to sell them on anything. I just want to go with them and just to talk about arthritis and to have them listen to a different perspective on what they in particular can do for themselves for their arthritis, how they can get themselves feeling better. And so I'm really adamant about trying to outreach as much as we can to the community that I'm born and raised in South Florida. So I really want to try to give back as much as I can to the community. And part of that is doing all these community outreach programs.
One thing I like about Dr. Shah, he doesn't have 10 doctors or 15 doctors or 20 doctors working with him. He basically sees the patient himself. Am I correct, Doc? You're looking at the patient yourself. And you're
I see the patient myself. I diagnose the patient myself. I treat the patient myself. It's very individualized. I love that personal relationship with each of my patients, and I want them to know I will be the one. When they call me, and a lot of my patients have my cell phone numbers. If they call me, I'm going to answer. I want them to know I'm there for them. I'm going to take care of them. We're going to get what we can do for them.
See, it's great to have, you're one of those old-time physicians, I say, in a young body. You're an old-time physician in a young body where you practice medicine the way it should be practiced. I mean, you really take care with the patient. You don't say, it's not all about the money with you. It's about curing that patient. And I really like that because you spend the time with the patient. Whatever the patient's necessary time you spend it with them. Again, Doc, we have a few minutes left. I want to go over again to get an appointment with you. Give us your phone number again, please.
So it's 954-281-8891. They can also find us on Facebook, find us on Google. They can even email us at frontdesk@floridaroomcenter.com. Again, tons of ways to try to get in contact with us. You can stop by the office at 5901 Colonial Drive, Suite 303 in Margate, Florida, right next to the hospital. If you have an issue, you think you have an issue, come by for a consultation. I'd be happy to help.
Well, Doc, we had you on. It's always a privilege to have you on. Like I say, an old-fashioned doctor in a young man's body. And it's great because he's up to date with all the terminology and all the new sciences that rheumatology has and with basically arthritis has. So if you're looking with somebody that has the knowledge and has the experience and spend some time with you, Dr. Shah's the guy. Doc,
I appreciate it. Thank you guys so much.
Totally appreciate it. And I'm going to come in and see you.
There we go. I really appreciate you guys asking me to come back on the show. I love this show. I really think it's great what you guys are doing for patients as well, trying to really a lot more of education. I think that's what's really needed in our communities.
Thank you, Doc. And I know when your patients come to All County, they get the best of care. I think you can guarantee that.
Yes, I can.
Thanks again, Doc, and you have a great day. Thank you
You
so
too.
much for
Be
coming
safe.
on. Bye.
Bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422 and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.